once again to the learning of blood pressure and hypertension and the various controls. Well, this is a difficult topic to understand. We talk about the cardiac output, we talk about the different equations which control the blood pressure. Now we have the cardiac output, which is equivalent to stroke volume into the heart rate, then stroke volume, how our stroke volume is calculated. Well, end diastolic volume minus the end systolic volume, which is equal to approximately 70 milliliters is the stroke volume. Then you calculate the ejection fraction. Ejection fraction is equivalent to SV upon end diastolic volume into 100%, and approximately ejection fraction in a normal person is equal to 58%. Then you have the next table, what is the next formula to be precise, the cardiac index. The cardiac index is equal to Q divided by body surface area, where cardiac index is equal to SV into HR, that is cardiac output upon body surface area. This is just a recap what we are doing. Then we talk about the mean arterial pressure. Then mean arterial pressure is equal to twice into dP plus systolic pressure divided whole by 3. And the last is the pulse pressure, which is systolic blood pressure minus the diastolic blood pressure, and in normal it is equal to 40. Well, these are the terms which we have already learned, and in the previous chapter of or in the previous section of our learning. Now we are going to talk about what is this mean arterial pressure in detail. What is why do we need to know about mean arterial pressure? When mean arterial pressure, as you know, if you can see here on the slide, map to be precise, is equal to dP plus 1/3 of pp. So try to understand that. We'll take a situation so that you understand it better. Okay, the situation is a normal person has a blood pressure of 120 by 80. So let's calculate the map, that is a mean arterial pressure for him. Mean arterial pressure will be equal to diastolic pressure. Diastolic pressure in a normotensive person is 80, and plus we need to add 1/3 of the pulse pressure. Well, pulse pressure is systolic blood pressure minus the diastolic blood pressure. So in a normotensive it is 120 minus 80, which is equivalent to 40. So 40 plus 80 is equal to 120. Right? No, but this is not the way we calculate it. We calculated mean arterial pressure is equal to 80 plus 40 divided by 3. So when you divide 40 by 3, then it comes to approximately 13. So the mean arterial pressure is 80 plus 13, and that's equivalent to 93 millimeters of mercury. So mean arterial pressure, it is considered to be the perfusion pressure seen by the organs in the body. A mean arterial pressure of at least 60 is necessary to perfuse the coronary arteries, brain and the kidneys. Normal range is approximately around 70 to 110 millimeters of mercury. It is slightly less than the value halfway between the systolic and the diastolic pressure, because systole is shorter than the diastole. So you put the diastole twice. In a patient of head injury, the brain is at the risk of ischemic injury due to insufficient blood flow if the MAP falls below 50, or on the other hand, a MAP above 160 reflects excess cerebral blood flow and may result in increased intracranial pressures. So there is a normal where need to be the perfusion of the cells and the tissues have to maintain, and that normal range is between 70 to 110 millimeters of mercury. Then we talk about the pulse pressure. Well, pulse pressure, as you know, is equal to the systolic blood pressure minus the diastolic blood pressure. It is the difference between the systolic and the diastolic reading. It is the force that the heart generates each time it contracts. If the resting blood pressure is 120/80, pulse pressure is 40. Pulse pressure is dependent on stroke volume and arterial wall elastic properties. Well, high pulse pressure is an important risk factor for heart diseases. A 10 millimeters increase in the pulse pressure increases the risk of major cardiovascular complications and mortality by nearly 20%. A pulse pressure more than 40 millimeters of mercury is abnormal, and it means that a heart valves are leaky or you have valvular regurgitation. A pulse pressure less than 40 millimeters of mercury means a poor heart function. The most important cause of elevated pulse pressure is stiffness of the aorta, the largest artery of the body. While the pulse pressure and the systolic pressures represents the gauge of arterial age, with higher values for either or both signifying greater age and lesser values more youthful age. So now we are going to talk about hypertension types and complications of hypertension. Now if you go to the next slide, you will see what is the definition of hypertension. Well, hypertension is defined as a persistent, undesirable elevation of blood pressure. Hypertension is increase in the systolic as well as the diastolic blood pressure above the normal range. There are two types, essential and the secondary hypertension. The essential hypertension in 90% of the cases is diagnosed as essential hypertension, whereas in few cases where there is an underlying cause, that hypertension is termed as a secondary hypertension, and you have approximately 5 to 10% of the patients who land up with secondary hypertension. Hello, good evening once again and welcome back. Well, we are going to talk about hypertension now. Well, you know the definition. Hypertension is defined as the persistent, undesirable elevation of blood pressure. Hypertension is an increase in the systolic as well as the diastolic blood pressure above the normal range. There are two types. You have the essential hypertension and you have the secondary hypertension. Well, essential hypertension is related to approximately 90% of the patients, and there is no underlying cause. For the secondary hypertension, there is always an underlying cause, and 5 to 10% of the patients are related to this type of hypertension. Well, what are the causes of secondary hypertension? Well, it can be obesity, it can be obstructive sleep apnea, it can be pregnancy, it can be coarctation of aorta, it can be due to herbal remedies and or illegal drugs. Then of course renal artery stenosis. An abnormal root may be an indicator of narrowing of the arteries supplying the kidneys. Of course, coarctation of aorta, it is narrowing of the aorta shortly after it leaves the heart with decreased blood pressure in the lower extremities or delayed or absent femoral arterial pulses. Well, it can be due to other endocrine diseases. Endocrine diseases like Cushing syndrome, thyroid disease, acromegaly, and pheochromocytoma. Well, pheochromocytoma is indicated in cases of paroxysmal hypertension or the labile hypertension, which is accompanied by headache, palpitations, pallor, perspiration, and this all should give you a prompt suspicion that the patient is suffering from pheochromocytoma. Well, pheochromocytoma is also responsible for secretion of catecholamines in the blood circulation, which leads to the increased blood pressure. This type of blood pressure is called as labile or paroxysmal. The reason being that it is not controlled by normal antihypertensive medications. Surgery is the only cure, and you need to remove the tumorous tissue from the suprarenal glands, and then only you can cure this labile or paroxysmal hypertension. Well, acromegaly is a term used for gigantism. If you remember Kali the Great, well, he is a giant. As the size of the body increases, probably the size of the heart also increases. So does the volume, so does the cardiac output, and so does the blood pressure. Well, in case of thyroid, it is hyperthyroidism, which leads to increased heart rate and increased force of contraction and so on, the cardiac output and as well as on the blood pressure. Then Cushing syndromes, all these are related to the steroid hormone releases, excess of them, and this cause water retention and increase in the high blood pressure. So the patients are having a cause, an underlying cause, which relates to the hypertension. So there is a term called as a hypertensive crisis. This is a malignant or accelerated hypertension. When a patient is having blood pressure over 180 stroke 110 millimeters of mercury, it is referred to as hypertensive crisis. And hypertensive crisis confers a high risk of complications. People with blood pressures in the range may have absolutely no symptoms. They might be asymptomatic. They might complain of headaches. They might complain of dizziness. They might complain of visual deterioration, breathlessness due to heart failures, malaise due to renal failures. So hypertensive crisis, as the word states, crisis, is an urgent emergency condition which needs to be treated. Well, there can be many complications due to hypertensive crisis, and they are called as TODS. TODS stands for target organ damage. So you can have the damage to the brain, which is called as hypertensive encephalopathy. You can have a damage to your eyes, which leads to retinal papular edema and fundal hemorrhages with exudates. Of course, chest pain, which may lead to myocardial infarction, aortic dissection, or maybe angina. And definitely pulmonary edema, which means you have, instead of air inside your lungs, you have water. So there is increase in the water content of the lungs. So you have breathlessness, cough, expectoration, that means passing of blood-stained sputum with swelling of the lung tissues. So all these organs can get damaged whenever you have an hypertensive crisis. Of course, when it comes to heart, we talk about the left ventricular failure, that is the inability of the heart, of the left ventricle, of the inability of the left ventricle of the heart to adequately pump blood into the lungs, into the arterial systems. Then if the kidneys are to be implicated and it results in acute renal failure, then you can have microcytic, angiopathic, hemolytic anemia. Oral use of medications to lower the blood pressure gradually over 24 to 48 hours is advocated in case of hypertensive crisis. You just cannot reduce the blood pressure immediately. It has to be a gradual process.